Sénatrice Mégy.
Merci, Madame la Présidente. Honorables sénatrices et sénateurs, je prends la parole aujourd'hui pour joindre...
Today I'm speaking to join my voice to those of several colleagues in this House. I would like to thank Senator Dean, who has invested a great deal of energy to share relevant data. Statistics from various reliable sources show that Canada is one of the countries with the highest prevalence of cannabis consumptions by youth under 20 years of age. I would like to speak about the social and health issues related to this situation. As you know, the human body creates its own cannabinoids, which are called endocannabinoids because they are produced inside the organism. These substances are a natural messenger. They transmit information regarding the state of the organism to both the brain and other organs. The endocannabinoid system mainly exists to regulate and create a stable environment within the human body. Namely, it is responsible for regulating appetite, coordinating motion, sensory perception, and pain perception. The active principles produced by the marijuana plant are also cannabinoids. Specifically, THC is one of the most important ones and has psychotropic effects, which is why cannabis is used for recreational purposes. These are called exogenous cannabinoids. There are almost 100 other cannabinoids that can be extracted from this plant, including CBD, which is often used for therapeutic purposes because it has no psychoactive effects. CBD is the object of a great deal of interest in the scientific world, given that it can be used to reduce epilepsy, including in children. There are promising studies currently being done on this subject. Both exogenous and endogenous cannabinoids use the same cerebral pathways, and their methods of actions are different and not very well known. Now, THC can take the place of endogenous cannabinoids and continue to do so for hours, which can cause an imbalance in the system. When it comes to therapeutic use, cannabis is increasingly promising and is familiar to experts in chronic pain and palliative care. The anti-inflammatory and analgesic properties of cannabis makes it useful in the management of chronic pain, neuropathic pain, and painful muscular spasms, specifically very often in MS. It is also often used to control nausea and vomiting, which are the secondary effects of chemotherapy, and can also help to stimulate appetite in patients with AIDS. One of the cannabinoid products used has been marketed in the form of a nasal spray, or an oral spray rather, and there are two other synthetic cannabinoids called nabilone and dronabinol, which are sold in pills with well-defined dosages, and these products have received a compliance notice from Health Canada, given that they are based on clinical data and can be prescribed by doctors. A study published in the Journal of Pain in June 2016 showed that the use of cannabis in controlling chronic pain was associated with a decrease in opioid use of 64%. My colleagues who work in the field of chronic pain pointed out that for patients whose pain is not sufficiently alleviated by opioids, it was preferable to add small doses of cannabis while simultaneously diminishing the doses of opioids, which can avoid increasing the opioid use and preventing the secondary effects of this use. In this context, some people prefer to smoke the cannabis or use cannabis oil. Only a small group of doctors are able to prescribe these products. And the patients must also fill out an exemption form. A study published in 2014 in the Journal of the American Medical Association in Internal Medicine notes that the number of deaths linked to consuming opioids went down by 33% in 13 states where cannabis is legal, and this information was gathered over 6 years following the legalization of cannabis. Now, when it comes to the harms caused by cannabis in youth, some studies show that consuming marijuana is not as inoffensive as popular wisdom might seem to indicate. Since neurons only become fully mature at 25, it is clear that the adolescent brain is still vulnerable. marijuana can cause psychosis, hallucinations, paranoia, the triggering of schizophrenia, and changes in cognition, as well as addiction. Dr. Romina Mizrahi, director of a psychosis prevention clinic in Toronto, at the Center for Addiction and Mental Health at the University of Toronto, says that young people who are vulnerable to issues of mental health are twice as at risk of psychosis if they use marijuana, especially when a member of their family has a background with psychosis. And cannabis can lead to an acute phase of psychosis in adolescence, even if there are no previous events of mental illness. We have to establish a difference between a psychotic episode and schizophrenia. Psychosis is a temporary loss of contact with reality, which can be induced by being impaired by a substance like alcohol or drugs, or can be a sign of the presence of mental illness like schizophrenia, bipolar disorder, or depression. However, it's not a permanent state. It can be treated, and most people can return to a satisfactory state of life. While schizophrenia is a brain disease which affects thought, feelings, and emotions, as well as the perceptions and behaviors of people with schizophrenia. However, these functions are not all affected at the same time or to the same extent. Many people with schizophrenia can behave in a completely normal way for long periods. The illness shows itself during acute psychotic episodes followed by various chronic symptoms. It generally occurs for the first time at the end of adolescence or at the beginning of adulthood, generally between 15 and 30 years of age. And unfortunately, this coincides with the age where people generally start to use drugs. It has been identified in the literature that there is a personal predisposition, a genetic predisposition, an imbalance of brain metabolism which involves the dopamine and glutamate neurotransmitters and stressors as triggering factors for schizophrenia. So it's not as simple as to say that cannabis causes psychosis, but there is evidence that shows that if there is an existing vulnerability to psychosis, this is a factor which influences the link between consuming cannabis and psychosis. And there's also other factors like the amount of cannabis ingested, the concentration of the substance, the frequency, and the environment of consumption. Recently, one of my colleagues, a family doctor who works in an addiction clinic, told me that we need to do more work to determine why young people consume cannabis. Apart wanting to be part of a group, some young people say that they want to be able to concentrate more or to feel less shy in social situations. So doctors must also try to find any comorbidity like ADD, hyperactivity, depression, or predisposition to schizophrenia. These are all factors that make youth more vulnerable to developing deleterious effects after consuming cannabis. In order to ensure that care works, we need to ensure that we're also treating the comorbidity as well as the drug consumption. Raymond and Burnett from the Drug Policy Alliance have also raised the theory of self-medication, which states that the possibility that some people who are presenting psychotic symptoms start to treat themselves with cannabis before the psychosis is formally diagnosed. The authors show clearly that those who are going through psychosis or who have experienced psychosis are more likely to smoke cannabis. So it's hard to determine which of these two things happen first, the psychosis or the cannabis use. Then there are effects when an individual stops using cannabis after using a great deal. Only generally after a daily or almost daily consumption of cannabis for at least several months. And these symptoms manifest 24 to 72 hours after the last episode of cannabis use and can continue for 1 to 2 weeks. Sleep problems can continue up to about a month later. Apart from these acute effects that we just discussed, the literature discusses long-term effects, including a decrease in school performance, not going to school, and a lack in social contact with friends. However, we should also state that these same Symptoms can also occur after excessive consumption of alcohol, including, in many cases, a coma or death. A paramedic told me that it's much more common to be called because of alcohol-induced psychosis than because of cannabis-induced psychosis. In 1971, the World Health Organization established a classification of psychotropic substances ranked by danger. Alcohol was the first one, then cocaine, and cannabis was only in the last place, 9th. But alcohol is a legal drug despite its very negative effects. And young people that I met with in a focus group last week told me that. Honorable Senators, regardless of our position on the legalization of marijuana, a number of our alarming facts can't be ignored. How do we reconcile what I've just mentioned with the fact that young people aged 12 to 17 will soon be able to possess up to 5 grams of cannabis? Why do you think young people have cannabis in their possession? They are either going to use it or sell it. I, for one, thought that the legalization of cannabis was meant to stifle the black market, not encourage it. Add to that the possibility of growing marijuana at home. How will parents ever notice that 1 or 2 marijuana buds are missing from one of their 4 plants? What will they say when their 12-year-old suggests growing cannabis? It will be legal after all. This is not a completely harm-free substance, and this could have an effect on all of society. Therefore, we have a duty to regulate and restrict access to cannabis. In order to justify home marijuana cultivation, many have compared it to making wine at home, which is legal. This argument is rather simplistic. Making wine is far more labor-intensive than growing a plant. Indeed, wine making requires a certain amount of knowledge, without which it is difficult to make wine for personal consumption. Given the dangers of cannabis use, we must adopt a public health approach. In particular, we must at all costs delay the age at which individuals begin using cannabis. We must work to decrease the frequency of consumption in order to reduce addiction problems. Moreover, we must ensure that non-consumers do not begin consuming cannabis simply because it is legal. To achieve these goals, we must make a collective effort to expand prevention programs while carrying out appropriately supported awareness and prevention campaigns. To ensure public safety, these measures must work in synergy with the communication strategies that are adopted. In addition to the usual media sources, we must also consider digital networks. Effective implementation entails taking the necessary time to ensure that legalization goes smoothly. After nearly a century of prohibition, people have the right to expect a smooth transition. In any event, our community should have the right to prepare for the new challenges they will face. Let's focus our energies on educating young people, parents, and families, and on training resources. These individuals should have a presence in schools and in our communities. Canadians must be made aware of the dangers of addiction, impaired driving, and consumption. We also need a federal management framework to regulate the production, points of sale, quality, and safety of the products available on the market. We will have to invest in research. With legalization, it will be easier to report to researchers and physicians, and the data collected will be more reliable. And also, they will be able to get more data. And this will also foster a better understanding of the effects of cannabis so that it can be used safely and so that potential health problems can be avoided. Honorable colleagues, let's take advantage of this momentum. Legalization will occur, but it should not be done at any cost. So let's take advantage of this moment to engage in deep and meaningful discussions in committee. Thank you.
Sénatrice Mégy, vous avez une question?
Senator Mégy, you have a question? Senator Galvez, rather. Yes, I will be happy to answer the question, says Senator Mégy. Senator Galvez, thank you very much for these very interesting remarks. As a teacher, I have often spoken to students who have a hard time concentrating, and after discussion, they tell me that they started smoking cannabis in order to help them concentrate. And a few months later, it's more the opposite that has occurred. So when they tell me that they had a bad trip and that they felt anxiety and fear, like a waking nightmare, is that a psychotic episode? Do you need 5 minutes, Senator? Agreed? Okay, 5 minutes. Senator Galvez, I finished my question. Well, it's the chicken or egg situation. Sometimes people have symptoms. People are timid, they can't concentrate. Very often this is because of ADD. Now, if initially this person had gone right from the beginning to their family doctor, they would have not needed to use cannabis. Or it could be something very, very banal, like an oral presentation in front of their class, but the young person is shy and smokes a joint, and after smoking a joint they feel good, so next time there's another activity in the classroom they smoke a joint again. So that's how this starts, their cannabis smoking behaviors start increasing. So we need to know more to understand about the situation of these people, because if it's about ADD, if the doctor treats the ADD, that lowers the risk that they continue smoking cannabis until they have a bad trip. Does that answer your question? Senator Moncion, do you have a question? Senator Meji? Yes, I'm happy to answer the question. In your speech, and you just mentioned it, you mentioned the issue of alcohol. And you mentioned that the effects of alcohol are more harmful than the effects of cannabis. The same. But with alcohol, as has occurred recently in Quebec, it can lead to coma and death. Whereas with marijuana, you can sleep for perhaps a very long time, but you're not going to end up in a state of coma or death unless they take marijuana, which is mixed with other drugs, hard drugs, that they're not aware of having taken. Given that currently it's illegal, they have to buy it somewhere where they're not familiar with what the content is. So speaking of the content of marijuana, and once again, I know you have more medical expertise, alcohol is considered a toxin which affects the organs, our heart, kidneys, and liver. Marijuana is considered a neurotoxin. Can someone overdose on cannabis compared to, for example, overdose of alcohol? Yes, both are possible. So when you drink too much alcohol, you're going to end up in a state of delirium at the hospital. If you take too much cannabis, you're also going to be at the hospital in a state of psychosis. Another question?
Please.
You mentioned in your speech that the effects of cannabis in people who, in young people who are affected, are reversible, are usually reversible or reversible. But I know from personal experience that young people have severe brain damage from the use of cannabis that has not been reversible. So I'm not sure what you meant by that.
Merci pour la question.
Thank you for the question. Psychosis, acute psychosis, when it occurs, is a transitory state, but the more profound deterioration, like the destruction of neurons, leaving school and other effects, that can have long-term effects, but it's acute psychosis that is only a temporary state. Someone won't stay in a state of psychosis for their entire life, because if that happens, then that's a different problem, not marijuana.